And welcome back to Wandering Through Wayne's World on WRPBTCV. And, any of you guys out there that know me, and most of you do, know that I talk a lot about oral health and teeth because I've going through such issues because of all the steroids I was on, and they kind of ruin your teeth. Well, I'm blessed to have Dr. Olin Tyler, and you are a dentist.
I'm actually a prosthodontist, specialty dentist.
Okay, explain that. Let's get that out of the way.
All right, so what a prosthodontist is most of us go through our 4-year dental program to become a general practitioner, a general dentist.
Right.
And then after you graduate dental school, you have an ability to specialize if you choose to.
Okay.
Most will go out into private practice at that point after their 4 years of dental school. But a few of us go into a residency program. And the residency program that I chose was prosthetic dentistry because of my background as a lab technician. So
Okay,
you probably heard of the orthodontist, right? Braces guy.
I didn't have to do it.
Oral surgeon.
Had to do that.
Periodontist.
Right.
Prosthodontist is a restorative specialist. So we do a lot of implant restorations, full mouth reconstruction, dentures, partial dentures, crown and bridge. Those are the kind of things that we specialize
and that's
in.
changed over the years because of implants, I think.
Yeah, implants, digital dentistry has become a big player in what we do.
Making it easier for you to get it to fit and all the things properly?
Yeah, I mean, it's a combination of implants secure things in your mouth.
Okay.
So traditional dentures, they're removable. They come in and out. They just sit on the soft tissue. They have the ability to kind of move on patients.
Right.
It takes a lot of coordination and learning, which is why you'll see patients that have had traditional dentures don't wear a bottom denture.
Right.
But then the implants can be used in a couple of different ways. We can replace a single tooth with them. We can secure a denture with them. Or we could do a fixed restoration, which means you place enough implants where the teeth do not come in and out anymore. And this is what you see a lot of the marketing, teeth in a day,
Right.
1 day smiles, all those terminologies.
I mean, is it possible to go in there, pull all the teeth that have to be pulled, put the implants in, get the teeth in 1 day?
Yes, that is definitely possible.
Really?
We do it frequently. Yep.
Okay.
You can have a failing dentition, and it's usually a team. Myself as a prosthetic specialist, usually will work with an oral surgeon or a periodontist to do these surgical procedures. And then you also have a lab technician involved, which I am a lab technician as well.
Okay.
But I do work with local laboratories, just time, to be able to treat more patients in my office. We'll remove all the teeth, implants go in, sometimes there's bone grafting, sometimes not. And then a denture is prefabricated that is converted into an immediate temporary.
Okay.
So we immediately load those implants, usually 6 to 8 on an upper arch or 4 or 5 to 6 on the lower arch, secured and screwed into the implants. And now the patient walks out without the extensions that a denture usually makes them have to have,
Right.
all the extra material. They go through a healing process, usually 3 to 6 months, and then we fabricate a final restoration. And the difference between the temporary and the final is just the materials that are used, the longer term.
Okay, I'm guessing in that time, it's healing inside.
Yes.
So I don't think that the day you walk out of there, that you should be chewing gum or eating ribs.
Right. No, there's
Okay, just a
definitely a
thought.
soft diet. There's
Okay.
a soft diet that's recommended during the initial healing period because the implants are integrating to the bone.
Okay.
Now, when you have enough implants that you get what we call primary stability,
Okay.
they've got good torque when they're placed into the bone, that allows us to actually immediately load them, and they share the force and still will heal successfully without too much trauma on those implants. Now,
My
if you
brother
only
got
have
them.
if you only have 2 implants, you don't want to load 2 implants. It's just not enough to take that force.
Okay, so I go in, you pull all my teeth.
Yeah.
You put, because I'm not a dentist, some sort of implant post or whatever?
Yeah.
How many do you put in?
Usually, it depends on the individual and what the opposing arch is and what kind of force we're expecting on the case. But most of the cases end up being 6 to 8 implants on an upper arch and 4 to 5 on the lower arch. And the difference is the density of the bone between our 2 jaw bones.
Okay.
Upper jaw bone is much more porous, so that's why there's usually more implants involved. Lower bone is much more like concrete, so we can get away with a few less implants, even 4 on a lot of cases. That's that all-on-4 thing that you'll see advertised.
The question that I know all you guys want to know is how painful is it?
Well, I mean, it's no different than having a tooth extracted. Implants don't cause additional pain. You still have to go through a healing process as you would if you were just to extract even a single tooth. Not extreme, not extreme. We usually manage it with ibuprofen. Maybe we'll give a little narcotic as a backup plan. But
Right.
most of our patients, if you follow the post-operative instructions, have no major issues.
Okay, so I come in to your office.
Mhm.
I get an exam. I
Yeah.
guess that would be the first thing.
Yeah, for sure.
Now, what happens now? Because you don't do it in one day.
No. We make a plan.
Okay.
We get a plan together. A
2010,
lot of,
I caught a very rare lung illness, and they treated it with antibiotics till they realized that it's really treated with steroids. So I was on 60 milligrams of steroids for months,
Mhm.
and that ruined all my bottom teeth
Mhm.
and most of my top.
Mhm.
So I went, and I was going to have implants done,
Mhm.
and the docs wanted to journal it. Then I had a heart attack. You can't have any surgery. You can't have any They don't want you to have elective surgery within
Right.
the first year.
Right.
So I didn't go to do it. It's pretty weird because when they looked at my bones, they were pretty strong.
Okay.
And I come from a family, and I guess genetics plays a part in your teeth.
Huge. Yeah.
Does it?
Yeah. Genetics plays a part in our anatomy. Period. Also, things like you just discussed, drugs that we take can cause dry mouth. Most of them do, and that has a potential to cause decay easier. Saliva is very protective. So some of our older patients that get hospitalized for a year and they come out of the hospital with a lot of decay that they didn't have going in because of the treatment that was necessary.
If they even have teeth at that point.
Yeah,
Okay.
and it just depends on what your habits are. A lot of patients aren't real regular with their hygiene visits, right? They kind of get sidetracked
Yep.
with work and everything else, and should be visiting a dentist a couple times a year to have examinations and keep up on things before they advance to a point where you're now losing teeth.
Okay, so we're running to the top of our time. It's interesting to me to like sugar-free and all. Really, does that really make a difference? I
Oh,
know
yeah.
that a lot of my teeth got ruined besides the steroids that I was on, probably because of soda.
Yeah, I mean, here's how it works: is bacteria are in our mouth, and they're gonna accumulate on our teeth if we don't brush them off, right? So they form a layer usually at the gum line that's initially called plaque. Plaque is soft; it can be removed with our brush and our flossing. But if we don't get it removed, then it turns into calculus, and calculus is a mineralized material that bacteria kind of house themselves in into our bloodstream. They can accumulate on valves in our heart. Artificial joints are an issue. This is why we pre-med some of our patients that have artificial joints or an artificial valve and cardiovascular, because bacteria, when we do a basic cleaning, we get the gums bleeding a little bit while we're doing the cleaning because
Right.
there's inflammation present. Those bacteria get into your bloodstream and can attach to other parts of your body and cause havoc for you.
You know, guys, it's so important, and I suffered through this, okay, and I was so excited to get all my teeth done by no fault of my own, okay, and I couldn't do it at that point. So how do people find you? You have a website? You have
I do.
A phone number?
So we're Stewart Prosthetic Dentistry, and we are located off of East Ocean in Stewart, kind of that traditional Dr. Row there.
Yeah.
By the Cleveland Clinic, now called, where Mark Memorial used to be.
By Molly's house.
Yeah, by Molly's house, exactly.
Everybody,
Yeah.
because we deal with Molly's house all the
Yeah,
time.
so do I. I've actually donated recently for Molly's house, but it's Stewart Prosthetic Dentistry. The website is www.stewartpro.com. Our phone number is 772-286-1606. And again, my name's Dr. Olin Tyler. I have some other titles after my name.
Okay, it's worth a minute just to, because
Yeah, I'll tell you a
I had the
little
whole
background.
alphabet when I was sitting talking to a prior. What are the
All right, so it's Olin D. Tyler II,
Okay,
CDT,
which is?
Certified Dental Technician.
Okay, so that was the basic.
Yeah, that was where I started.
Okay,
And then DMD, which is my dental degree,
right.
and then MS, which is a master's in dental sciences.
Wow. Okay.
That's when I earned my prosthodontic specialty.
Oh, okay. I got
And then
that now.
PA, which is just that I'm
Professional
incorporated.
assistant.
Yeah,
So, I want to thank you for coming on. I want to thank you for that information.
it's a pleasure.
Check out Doc. Okay. You know, he says something that my dad used to say to me all the time: "Take care of your teeth. Take care of your teeth.
sure.
Take care of your teeth." I was not one to take care of my teeth, and I come from genetics that were always had bad teeth, and I could probably relate my heart attack to my diet and probably my teeth. With that, everybody have a great day. We'll be back.
Thanks for having me.